Did you know that Zyprexa can be used for schizophrenia as well as bipolar? It has also been known to have minimal side effects compared to other antipsychotic medications. However, the bottom line is Zyprexa or olanzapine is an antipsychotic. What's up, everyone? This is your daily dose of mental health, and in this video today we will be discussing olanzapine or Zyprexa and how it is used in the clinical setting. Also, what I have seen in the clinical setting, being a psych RN, what the common side effects are, questions that patients have when they first start taking it, because typically it is the first line defense drug for somebody who's been diagnosed in particular with something like schizophrenia. Also for somebody who has bipolar type 1 or 2 that hasn't responded to bipolar medications such as lithium. Before I go any further, please like and subscribe to the channel. Drop a comment on a topic you'd like me to cover in the future. Also, ring that bell icon in that top right hand corner, and let's jump right on into it. Alright, so as stated prior, Zyprexa, also known as, you can say, olanzapine, is an antipsychotic. It can treat, as I said, schizophrenia and bipolar disorder. And typically, as I said, it is a first-line medication that is used for people who have just been diagnosed with schizophrenia, and typically it is used for people who have not responded to bipolar medications. Typically, lithium would be the main one we're talking about today. Also, Zyprexa is thought, let's go into the background, Zyprexa is thought to rebalance dopamine and serotonin. Now remember, those are two brain chemicals in our brain. If they're imbalanced, it can cause things like schizophrenia or bipolar or even depression. When they're rebalanced, Zyprexa is thought to improve, once again, the most common and researched are thinking, mood, and behavior. You might be thinking, well then how does that help with somebody with schizophrenia? A lot of times somebody who's been diagnosed with schizophrenia, yes, they can have visual or auditory hallucinations, but the prime thing that it needs addressed is their thinking, mood, and behavior, because if these three things are not addressed, that will just make the visual and auditory hallucinations a lot worse in a lot of cases. So if we can attack the serotonin and dopamine and rebalance them, if they can improve the thinking, mood, and behavior, that can actually really help with and decrease the voices, auditory or visual hallucinations that a patient would have. Next, really important, Zyprexa is an atypical antipsychotic. I'll go into more detail in a minute, but first let me just state, Zyprexa is a second generation antipsychotic, meaning it has been shown to be more tolerable with less side effects. And I know I've already mentioned this, but the reason why I keep hammering this in, it's because a lot of times people are very concerned with things such as weight gain, and the big thing is tardive dyskinesia. Tardive dyskinesia is essentially, it is abnormal movements, and in particular, the number one symptom with antipsychotics when it comes to abnormal movements, it's abnormal tongue movement. So like somebody who has tardive dyskinesia, a lot of time, their tongue, they can't control it. And that is one reason why Zyprexa is typically a very good first line drug to use for somebody who has schizophrenia, or even somebody who has been diagnosed with bipolar type 1 or 2, because it doesn't have near the side effects as some of the other antipsychotics. For example, I wanted to just go in here. So as I said, Zyprexa is a second generation. The first generation antipsychotics, which are called the typical antipsychotics right here. You might be thinking atypical sounds worse. No, they both have their place, but the typical antipsychotics, which are first generation antipsychotics, Zyprexa is a newer one, second generation, and I'll maybe do a third generation video in the future, but I just want to focus on this. The typical first generation antipsychotics are dopamine antagonists, so they're just really trying to balance out the dopamine levels. An example of a first generation antipsychotic would be the biggest one I'm going to talk about, which there's other ones like Risperdal, but in this video in relation to things like schizophrenia is Haldol. Haldol is a first generation antipsychotic that is very helpful for people who have been diagnosed with schizophrenia who do not respond well or do not have a response to something like Zyprexa, meaning they've been on the medication for a long time or it just doesn't work for them. Haldol is used. It's a first generation, but the number one problem that patients state to me that I've seen in the clinical setting is it has a lot more side effects, and as I mentioned above, tardive dyskinesia. That's why Zyprexa is preferred as being a first line for less side effects, because tardive dyskinesia, the chance of developing it is a lot lower. And especially for somebody who's just starting Zyprexa, for example, you typically start a dose at 2.5 milligrams or 5 milligrams, PO meaning oral, and they have one sublingual you can put under your tongue or you can just swallow. Tardive dyskinesia or abnormal tongue movement or abnormal muscle movement is greatly reduced. Typically, however, even with Haldol at low doses is stated, typically you'd start at 5 milligrams. There is a higher chance of somebody developing abnormal tongue movements, and typically what you would use as a reverse or something that would minimize the side effects would be something called, and I'll just write it right here, cogentin, which helps with that abnormal tongue movement. And it can be used with like Zyprexa if it's developed. And typically, I'm talking like if you're gonna develop tardive dyskinesia with Zyprexa, it's doses that are above greater than 15 milligrams. Typically, as I said, if you start at 2.5, I know this is hard to read, your chances of developing it are a lot lower. Or even 5 milligrams, twice a day. So next, real quick, as I've said, what I have seen in the clinical setting with Zyprexa, it helps. What it really helps for patients who have schizophrenia or bipolar, the number one thing they typically report is a lot of them have trouble sleeping. Zyprexa helps with sleep. However, what I will say is if they have problems sleeping, but they also have nightmares, the nightmares will still need to be addressed, typically with another medication like Prazosin. Next, it also helps, one of the big key takeaways, it helps with racing thoughts. As I said, racing thoughts are one of the biggest problems that people who have schizophrenia report with their auditory or visual hallucinations as they have racing thoughts. So as I said, if you can attack thinking, mood, behavior, as well as, once again, racing thoughts, which is very commonly reported, and even somebody who's bipolar, if you can minimize those racing thoughts, it will help with sleep, but it will also reduce their anxiety and depression. And when you reduce racing thoughts, it's only gonna bring down the chances of those voices that are nonstop. They continue, they can't sleep, and it makes them, it really does. And I've seen somebody who, when they're on medication like Zyprexa or even Haldol, they're completely different. Their racing thoughts, their mood, their anxiety, even depression, and also their auditory or visual hallucinations are not, I'm not going to say gone, but minimized. But when they first come in, and let's say they got off the medication for whatever reason, they'll be pacing. Having a conversation with them, you have to remember, with somebody who has schizophrenia, when you're trying to have a conversation with them, especially when they're off medications at first, it it can be very tough, because when you're asking them questions, they will have very delayed responses, because they will be, remember, they're responding to a lot of that internal stimuli that's going on. That's another big thing, is the internal stimuli. So key tip to anyone out there who knows someone or a loved one, or just in general, if you know somebody with schizophrenia, don't get mad at them if they're not on medication or they've just been diagnosed and they are having delayed responses and it seems like they're ignoring you. That's not what's going on. It's that responding to internal stimuli. It is something that a lot of people really don't understand unless you really take time to educate yourself on, especially if you have a loved one with schizophrenia, and how you can help them. It's advocating for them to continue medication, and if they're having problems with the medication, to seek medical help to address it and get them on a new medication. Because typically what will happen is if they stop their medication and the voices get worse, one of the number one things that can happen is they will go use street drugs a lot of times. And I'm not saying that certain, like marijuana, things like that can help people with schizophrenia. It can, but a lot of people that are homeless and whatnot and can't hold down a job with schizophrenia, they'll go to harder drugs, which will just make the voices a lot worse. But that's sometimes the only way they can cope with it if they're not taking medication and not seeing a medical provider. So next, real quick, another thing that it can really help with is, as I said, it minimizes the side effects. It has minimal side effects. Plus, it's a first-line drug treatment if you've just been diagnosed. So the reason why I put that with what I've seen in the clinical setting is because if you have just been diagnosed with schizophrenia, or you know somebody who's hearing voices and you want to get them help, you can tell them about the medication Zyprexa in particular, because it does have minimal side effects. In particular, because you'll read on the internet, of course there are some side effects, which I'll go into in a second. Compared to the first generation antipsychotics, the typical ones like Haldol, it is a great starting medication to use because of the minimal side effects. Now, real quick, some side effects right here that I wrote down right before making this video that I wanted to mention that patients do report is weight gain. However, it is minimal. Sleepiness and constipation. However, you have to remember that this in particular, the constipation can be addressed. The weight gain, when you have first started this medication, they started a very start low, go slow. At low doses, the weight gain is minimal compared to other antipsychotics. And with a lot of psych meds in general, weight gain is common with antidepressants as well. Sleepiness, as stated a lot of times, sleepiness sometimes is not a bad thing, because a lot of times people with schizophrenia or severe bipolar disorder don't sleep. So at first they'll report having some daytime sleepiness, but that typically will subside as you continue to take the medication. Lastly, big key right here, I want everyone to pay attention to. If you or a loved one do start experiencing SI, which is suicidal ideation, when starting Zyprexa or in general, call your healthcare provider immediately or 911, because that would indicate that the medication is not working for you. Once again, I'm not advocating, but I'm not telling you that it will work for you. I'm just educating you on what I've seen in the healthcare setting as a psych RN, and why this actually can really help if you have just been diagnosed and you're worried about side effects. Zyprexa is a very good starting antipsychotic. And as I've mentioned, we have to bring down the stigma of schizophrenia. I've seen people who are on their medication who come into the psych setting, inpatient or outpatient, who have schizophrenia or bipolar, who are working full-time jobs, contributing to society, and you wouldn't even know it. The key is making sure they stay med compliant, and them having the resources they need if they need help for whatever reason. Lastly, real quick, I just want to thank you all. I've just hit a little over 200 subscribers, and we're going to keep on pumping out videos. And the next video I will cover, I'm going to do a video on Haldol, and I will do a video on just a motivational video for some, and kind of go back to my own past before becoming an RN, where I was, and why I started this channel in the first place. You can see I have my whole drug withdrawal journey. I cover everything psych related, from drug education to drug addictions to also just mental health in general and motivation. I like to think of myself as helping just motivate you to know that you can get help, and you can, whatever's going on in your life, it can get easier for you. Once again, thank you for checking out the video. Please like, subscribe to the channel if you're new, and if you really want to, hit that bell icon. You will get notifications when a new video drops. And please leave a comment on a video you'd like me to cover. I forgot the person's name, but they asked me to put out a video about just a motivational video, which I will do. So if there's anything you want me to cover, I will cover, because working in the psych field, if I don't know specifically about it, I will at least research it. But more times than none, I know I've got a good grasp on knowledge in regards to just the psych field in general. Being a psych RN, I'm an inpatient psych RN who works full time, and this whole thing is just clearly to help others, because I do know that a lot of times when people do start new medications, the doctors don't tell you any of these side effects. That's another big reason why I do this channel, and don't give you education you need. And I'm here to tell you from patient experiences to also drug education and knowledge that you need to know if you're starting a medication or a loved one is starting a medication, things to know. Once again, I love you all. Have a great weekend. Be safe. Once again, please like and subscribe and leave a comment, and I will get back to it as soon as I can. I love you all. You do matter. This is your daily dose of mental health, and we're going to continue on this channel and keep pushing out a video at least once a week. Once again, I love you all. Have a great weekend.